You already know how important it is to discuss brain health and modifiable risk factors for cognitive decline with your patients. By taking simple, proactive steps, you can help many patients delay or prevent dementia. And the sooner you start talking about brain health and addressing modifiable risk factors, the better, because the first symptoms often appear long after neurological changes begin. But how do you distinguish normal cognitive aging from dementia? What are the clinical symptoms of cognitive decline and dementia? And how do these conditions progress over time? Let's break it down. The differences between normal age-related cognitive changes and cognitive changes associated with Alzheimer's disease can be subtle. For example, normal aging is associated with occasional lapses in memory, such as forgetting names but remembering them later. On the other hand, memory changes related to Alzheimer's disease include persistent memory loss, such as forgetting recently learned information or asking the same questions repeatedly. The ability to complete familiar tasks can also differentiate normal aging from dementia due to Alzheimer's disease. In normal aging, individuals may occasionally need help with a device or appliance. In contrast, Alzheimer's disease often results in significant difficulty using appliances and devices, or in getting lost while driving to familiar places. Understanding these differences can help you provide clarity and reassurance to patients and families. It's also important to know that the progression of symptoms related to the neurological changes of Alzheimer's disease follows a defined trajectory. In the preclinical stage, which can span many years, individuals don't exhibit symptoms but demonstrate measurable brain changes and biomarkers of Alzheimer's disease. In mild cognitive impairment, or MCI, due to Alzheimer's disease, cognitive decline becomes detectable but doesn't interfere with daily activities or overall functioning. In contrast, dementia due to Alzheimer's disease presents with impairments in memory, language, thinking, and behavior that disrupt a person's ability to function in daily life and worsen over time. So Alzheimer's disease ultimately deprives patients of the ability to perform even the simplest tasks. So beyond discussing brain health and addressing modifiable risk factors, is there more you can do? Yes. Being aware of symptoms and the differences between normal aging and dementia enables earlier diagnosis. For even earlier detection, the neurological changes of Alzheimer's disease can be identified before clinical symptoms appear. You're probably familiar with long-standing Alzheimer's disease biomarkers and tests used to detect them. Levels of beta amyloid and tau can be measured in cerebrospinal fluid or through positron emission tomography or PET scans. Magnetic resonance imaging, or MRI, can detect degeneration in the brain. However, imaging tests are often expensive and may not be easily accessible, and many individuals may be hesitant to undergo a spinal tap for cerebrospinal fluid collection. In addition, current clinical use of biomarkers is primarily intended for symptomatic patients rather than cognitively unimpaired individuals. This may soon change, however. Blood-based biomarkers may soon be available for routine clinical use. In fact, a blood test for tau demonstrates sensitivity and specificity comparable to FDA-approved tests that measure tau in cerebrospinal fluid. And compared with cerebrospinal fluid and PET scans, blood-based biomarker tests are more scalable, cost-effective, and accessible, making them a promising option for broader implementation across clinical settings. Of course, some individuals may want to know whether they have biomarkers associated with Alzheimer's disease. Others may prefer not to. As blood-based biomarkers approach clinical use, it's essential to consider the potential impact of a positive test on both the patient and their family. So, to navigate these decisions effectively, it will be imperative to use a shared decision-making process. Explore how the patient would feel about knowing their risk for dementia. Find out how the test results might influence long-term decisions. Understand their values and what matters most to them, and address any concerns they may have. Give your patients and their families the best information you can so they can make an informed choice. And during these discussions, bear in mind that earlier diagnosis has large benefits for patients and their families. For patients, early diagnosis provides opportunities for earlier intervention, including potential anti-amyloid disease-modifying therapies, participation in clinical trials, a longer period of independence, greater involvement in care decisions, and proactive management of legal and financial considerations. For families, early diagnosis allows more time to adjust to changes in the patient's function, mood, and personality, and even reduces anxiety and depression. In fact, studies show that approximately 90% of individuals with dementia prefer to receive a diagnosis as early as possible, and perceived delays in diagnosis are associated with sadness, anger, and despair among family members. Timely diagnosis is possible. You can make a difference knowing the cognitive changes associated with dementia and how they differ from normal aging. Recognizing the progression of symptoms, investigating biomarkers when appropriate, and preparing for the availability of blood tests in routine practice. Don't delay. Detect cognitive decline in Alzheimer's disease early and give your patients and their families the gift of time.